Preview. Preview. Preview.
Bagong araw, bagong pag-asa, tara na't mag-aral tayo magsaya. Music, arts, PE, and health, ang ating asignatura. Tayo'y umawit, magumuhin, at tayo'y maglaro. Alagaan ang kalusugan, tayo'y mag-ehersisyo. Sama-samang matuto sa araling ito. Mag-music, arts, PE, and health na tayo. Sama-samang matuto sa araling ito. Mag-music, arts, PE, and health na tayo. Mag-music, arts, PE, and health na tayo.
Good day! This is your Health 9 teacher, Mr. Joe Valencia. Before we go to our lesson, let us have a review first of the past lesson. Did you get it right? Great! Now, look at the picture. What do you see? You saw a cut, bleeding, and a bandage. Right! That is a wound, which brings us to our most essential learning competencies. What is a wound? According to Merriam-Webster.com, a wound is an injury to the body that typically involves breaking of a membrane and usually damage to underlying tissues. It falls into two broad categories, open or closed. In a closed wound, tissue damage and bleeding occur under the surface of the skin. An example is a bruise. An open wound involves a break in the skin that leaves the internal tissue exposed. In this lesson, we will focus on open wounds. What are the types of open wounds? Incise wound, a clean straight cut caused by a sharp edge like a knife. Laceration, a messy looking wound caused by a tearing or crushing force. Abrasion, a wound caused by a scraping force or friction. Avulsion, a wound caused by a tearing force in which tissue is torn away from its normal position. Puncture wound, a deep wound caused by a sharp stabbing object like a nail, may appear small from the outside but may damage deep tissues. Why is prompt wound care important? Our goal in providing prompt and proper wound care is preventing bleeding or blood loss and infection, both of which can be life-threatening. There is also a better chance to manage pain and promote healing more quickly. How should wounds be treated? Always wash your hands and wear gloves or personal protective equipment for your protection and others. Stop the bleeding. Continuous bleeding can quickly progress to shock. Shock is a lack of oxygen in the body due to a dangerously low blood pressure or a sudden fall in blood volume. Here are the symptoms of shock. To control bleeding, apply direct pressure and elevate the bleeding body part above the heart. In case of shock, lay the person down and raise their legs. Removing foreign bodies is not always recommended, especially when it is embedded, as doing so can encourage bleeding. To help us achieve this, we will need the help of a dressing and a bandage. A dressing comes into direct contact with the wound. Use it to apply direct pressure and absorb blood. If blood soaks through it, do not remove it. Just put more dressing and continue applying direct pressure. A bandage is used to hold the dressing in place and to apply and maintain pressure over a wound. In the next clip, you will learn the most common bandage used, tying a square knot, and the different techniques for different types of wounds. Cleaning of wounds should be done after the bleeding is controlled. Application of ointments and antiseptics like povidone iodine should be done with caution, as some people can be allergic. Cover the wound, but make sure it can breathe. Leave minor wounds uncovered. Change the dressing regularly. Get a tetanus shot if you have not in the last 5 years, or if the wound is deep and dirty. See a doctor if signs of infection develop. Always use your best judgment to execute the best action. It's now time to test your knowledge. You have 30 seconds to answer this. Did you get 5 out of 5? Excellent! If not, it's fine. What's important is your honesty and willingness to try. For your assignment, I hope you enjoyed our lesson today. This is Sir Job, wishing you a safe and pleasant learning journey. See you all next time.